So good morning, everybody. Welcome to the Thrive team's supporting return to work following COVID-19. Absolutely delighted to be working in partnership with Beverly, Coghlan and Dr. Elizabeth Barley from Actworks Ltd. I'm going to hand it over to them and they will present over the next 90 minutes or so. So thank you so much for joining, and I'll hand over to Beverly and Elizabeth.
Thank you. Thank you. Good morning, everybody. It's a pleasure to be with you. I think it's as good a time as any to have this webinar. COVID's going to be with us for quite some time to come, I think, and we're going to be facing the issues of working with people who've recovered and are coming back to work, and people who haven't had it and are coming back to work. So, and I think there's some unique issues that are presented by that. Elizabeth and I are coming at it from perhaps a slightly different angle. Neither of us are career coaches or executive coaches. We're both clinicians. I've been a nurse for about 40 years and a clinical researcher for about 30. And the last 20 years, the best part of 20 years, I've been a psychotherapist. And a lot of my work is involved with getting people back to work after they've had various difficulties. I'll just let Elizabeth introduce herself to you, and then we'll get on with our presentation.
Hi everyone, so I'm a health psychologist and also an adult nurse and an ACT therapist too. My sort of day job is I'm a professor at the University of Surrey of mental health sciences and nursing, and so I do a lot of research around mental health and also using ACT in research as well. And then I have a private practice and work with Beverly as well. And a lot of the people I see are, coping with long-term conditions, managing their health, trying to have normal lives despite having ill health or depression or anxiety.
So I'm just going to share my screen now, and we will get on with our presentation. Okay. So that's our introduction. So what we offer at Actworks is training and therapy for groups or individuals, and that's either face-to-face or in groups or increasingly online now. And we use an approach called ACT, which stands for Acceptance and Commitment Training. In a therapeutic sense, it can be acceptance and commitment therapy. And this is an evidence-based approach for developing psychological skills to help people manage life difficulties and work towards a sort of rich and full and meaningful life, however they define that. And it's got about 30, almost 40 years of research evidence behind it, and well over 100 clinical studies showing its efficacy. In this workshop, we're going to spend about 90 minutes. It might be a bit shorter, it might be a tiny bit longer. Martin's already gone through these things. We'd encourage you to use the chat box to ask questions, and Martin's going to monitor those for us. And we don't mind being interrupted, that's absolutely fine. As both of us are behavioural psychologists, we appreciate positive reinforcement. So if you do want to put a thumbs up or something like that, we'd very much appreciate that. That would be great. What we're going to cover is we're not going to go into noticing signs and symptoms of COVID-19. I think you're probably as much up to speed with that as we are, but we are going to try and give an understanding of the physical nature of the disease and the residual symptoms and how that impacts return to work, particularly understanding why ICU admission has such a big impact on recovery. It's important to know who needs help and what help might be needed, and that comes to understanding the psychological needs, I guess. And then we will give you some links to external evidence-based help. That's on a slide, but we can share that with you afterwards so that you've got that. And we've already mentioned that we're going to be using this ACT approach. We'd also quite like to know what you would like to know outside of those objectives that we've set. So if there's anything else that you would like to know, perhaps you can share that now, and then we can have an idea of how to actually address that throughout the presentation. So if there is anything, perhaps just type it into the chat box now. it may be that you don't know what you don't know, or that you'd like to know, but it comes up during the webinar. That's absolutely fine. Right, so I'm going to hand over now to Elizabeth, and she's just going to talk with you a little bit about COVID-19.
Yes, hi, thanks Beverly. I'm not going to go into too much detail because I don't think there can be a person in the world who doesn't know what COVID-19 is, but just to set the scene, it's a new disease caused by a new coronavirus. So we've had coronaviruses around for a lot of the time, most of them fairly harmless, cause cold-like symptoms. You will have heard of SARS and MERS, which are also very infectious and dangerous diseases. This disease is less dangerous but more infectious. So I'm sure you all know that. So I have to ask Beverly to change the slides because she's the only one with control. So I'll do this for the next slide, please. Thank you. So what do we know about recovery from COVID-19? So that's the focus really of this workshop and how it impacts on people at work. So the answer is we don't know that much because obviously it's a new disease. So really we don't know what is the true length and course of recovery. There are data coming from different places that are more or less consistent, but some inconsistencies. So for instance, the World Health Organization's data shows that most people recover after a mild case of COVID-19 in about 2 weeks. So that would be probably quite similar to if you had flu, for instance. But if you have more severe disease, they're predicting 3 to 6 weeks recovery. However, there's the COVID app study conducted by King's College London, which has thousands of participants in it, and they found that 1 in 10 people are saying it's taking them more than 3 weeks to recover. And then, of course, from the media, we've had all these reports of strange and alarming effects. You know, any symptom you can imagine, it's been attributed to COVID-19, and patients have actually come up with this term long COVID, which we'll be talking about a bit more in detail in this workshop. But one thing we do know is that fatigue and mental health problems seem to be a feature of this long COVID or recovery from COVID, as they are from many viral infections. So we're going to focus a lot on fatigue and mental health, largely because these are the things that really affect people's ability to work. And also these are the things that can be managed well with the ACT approach that we're introducing to you. So this is just some information about people who've been to hospital with COVID. So most people are fine, 80% of people, but we know between 1 in 5 and 1 in 6 people develop breathing problems and then end up in hospital. So it's quite good to know what to expect if your employees are going into hospital. So you can see from here that most, just over 50%, go to hospital, recover, and then come home and are pretty much okay. The other sort of just under half discharge from hospital, but might take a good 6 weeks to sort of recover properly. Then there's a small percentage, just under 10%, who might need a bit more intensive rehabilitation and might need to go to another setting from hospital. And there's the unfortunate, very small 2 or 3% who have such severe problems from COVID that they might need long-term care. COVID will have been absolutely life-changing for them. And these are people who've probably had sort of organ failure, and they will have been in ICU and had the most severe disease. So thanks, Beverly. So what do we know about recovery in general from COVID-19? Well, we do know that people who've got existing health conditions, so diabetes, lung disease, asthma, and chronic bronchitis, for instance, are likely to have the worst outcomes. And so they might find that their conditions have deteriorated after they've had COVID-19. So they might be needing more healthcare appointments and more help to manage and get back on a sort of stable level with those conditions. There's some evidence now that COVID makes your blood sort of extra sticky. This can lead to problems such as stroke, heart disease, pulmonary embolism. Pulmonary embolism is potentially fatal and usually occurs from following a deep vein thrombosis that people, you know, who might have had even mild disease, who are just sitting around a lot. So if you're working at home, that can be a big danger. So people need to be aware to look out for deep vein thrombosis, which would be in the form of swelling or pain in their legs, because that could potentially become life-threatening. Longer term breathing problems, so people who've already got breathing problems will find this, but we're also seeing it happening to people who've never had problems with their breathing. And that can be very frightening if you're not used to being short of breath. People find that very a great source of anxiety. But as we've said, so the most likely likely problems are fatigue and mental health problems. So let's have a look at those in a bit more detail now. Okay, so this is a list of psychological symptoms that's been put together by the British Psychological Society. They put together an expert panel to look at the evidence. So anxiety is very common. Talk a bit more about sources of anxiety that are related to COVID later, and low mood or depression. People get very fearful of being made, you know, more severely ill, especially with all these reports in the media of the long COVID and all the very strange symptoms and things, and the lack of certainty and the lack of knowledge around what's happening. It's very unsettling for people. And what you can sometimes end up with is what we call hypervigilance of bodily symptoms, where, you know, we all have aches and pains and strange sensations, and it's normal and mostly we don't notice them. But if you're worried that something terrible is going to be happening to you, you're paying sort of extra attention, and that can lead to much more anxiety and can lead to people changing their behaviour and not functioning as well as they should be in work or other situations. Nightmares or flashbacks been reported, and this is particularly related to people who might have been in intensive care units, and Beverly's going to be covering why that might be quite soon. Also poor sleep, so it's very common when you're ill to have sleep disturbance, but if you've had a long stay in hospital, for instance, you can just get out of your normal sleep routine, and it can take a long time to get back into normal sleep patterns. There are other physiological reasons that we don't fully understand, but insomnia is something that Beverly and I both work with and that responds very well to ACT. There's good trial evidence for that. And then people are talking about problems with their sort of general functioning, their memory, their attention, and they talk about a sort of brain fog, particularly in long COVID. And this is commonly known. We don't really know why it happens, but people who've got chronic fatigue syndrome have this. So, and again, that's very frustrating and creates a lot of anxiety for people. And then finally, fear of stigma. So people don't like to be thought of as, you know, unclean. So if they have a virus, and if you're somebody like me with asthma who coughs a lot normally, you feel like an absolute pariah, you know, if you make any sound in public. And then other people will be highly fearful of contaminating other people, particularly if they live with people who are considered vulnerable. So, I mean, these are all normal fears, but they become pathological when they sort of take over people's lives and start affecting their functioning or the choices that they're making in life. So often people might need some help to sort of put that into perspective and try and be able to make the choices they need to make despite feeling like that. So, thank you. And then fatigue. So this is a strange phenomenon because fatigue's been around a long time, been recognised, but we don't fully understand what causes it from a physiological point of view. And it can range from a sort of general tiredness that you might have after a nasty cold or bout of flu to absolute physical exhaustion where every part of your body feels exhausted and heavy and unable to function. And it's common to have some level of fatigue for a couple of weeks post any infection. What we do know of is if you rest properly and manage it early on and get some help, then it's less likely to deteriorate into a severe level of fatigue. But unfortunately for some people that does happen. And what usually happens that fatigue that carries on for about 4 months and really interferes with people's activities is sometimes diagnosed as post-viral fatigue syndrome, sometimes known as chronic fatigue syndrome or ME, that all the same things. And, you know, it is very poorly understood. And then what often happens is that it gets attributed to being all in the person's mind. You know, just because we don't know what the physical cause is, we say it's psychological. And then for some reason, if something's psychological, we tend to dismiss it and not take it seriously. So in the chronic fatigue syndrome population, there's quite a lot of mistrust and negative relationships with healthcare professionals and people feeling they're not being taken seriously, which really doesn't help in their recovery at all. And then fatigue is often associated with burnout, which I think is the next slide. Thanks, Beverly. So I'm sure you will have come across the idea of burnout. It's been studied a lot in healthcare professionals, but it does happen in and can happen in any profession. So it's a particular type of stress that's been associated especially with negative interpersonal interactions, so not getting on with line managers or clients or your patients, having difficult relationships, which leads to a sort of emotional and physical exhaustion and fatigue. And then how people cope with it is they sort of detach from the situation and can become quite cynical, particularly if they don't feel they're supported by their colleagues or their employers. But then unfortunately that cynicism and detachment, although it's helping them cope with the stress and exhaustion, leads to a sort of sense of inefficacy and a lack of sense of accomplishment. And then people start to feel that they're incompetent and unproductive. And that of course does nothing for your interpersonal relationships with your managers or your clients, which then goes again to more exhaustion. And then you end up in this sort of burnout cycle where you get worse and worse. Okay. Thanks, Beverly. So I thought it might be useful to think about who might have problems recovering. So the main thing to think about is, you know, it's not possible to totally predict, but there are some groups of people who might be at more risk. So we can think about them proactively maybe. So we know that people who've got more severe disease, particularly people who've been in intensive care units, ICU, or who've had long hospital stays, or people who've had a lot of different symptoms, they seem to be at risk of having a longer recovery. And we know that there are people who are more at risk of having those severe disease in the first place. So it seems to be worse for men, people with comorbidities, that means other conditions like the diabetes or the lung diseases. People who are obese have a lot of problems with COVID-19 and with the recovery. People from BAME backgrounds, particularly South Asian backgrounds, older people, people from lower socioeconomic groups, and people who smoke, all at more risk of having problems with the disease. Although not everybody, you know, it's very individual. We also know people who've got existing mental health problems are likely to be at risk of worsening problems in recovery, and also worsening problems during lockdown as well. I know Beverly and I have been seeing people who are really, really struggling with this situation, because often the coping strategies they've got in place might be things that you're not allowed to do in lockdown, like meeting friends or doing activities and things. Bereavement's a big issue to think about in terms of people coming back to work. So obviously people who've had COVID or people who haven't had COVID might have lost people, and because of all the restrictions we've had, sometimes it's not been possible to go through those sort of normal grieving rituals that help us cope with bereavements. So, you know, if you've been to a funeral and you're not allowed to go in because they're only allowed 6 people there, or that kind of thing, that can be very hard for people. And also unexpected bereavement is very difficult for people to cope with as well. And then long COVID, so the latest information comes again from the COVID app study, symptom app study from King's, where they've got over 4,000 people. And they're finding now that 1 in 20 people are saying that the recovery is taking them more than 8 weeks. So that's quite a lot. And the people most at risk at that have seemed to be women and those who had more symptoms in the first week of the illness. So we don't really know why that's the case, but that's just the pattern in this self-reported data that's coming from King's. So thanks, Beverly. So any questions on that part? I can see there's something in the chat.
There's one question in the chat from Claire. We have some staff with high levels of anxiety about working with COVID. Understanding how to work with some of these staff would be really useful, really helpful.
Yeah. Yes, no, and I'm sure, you know, and I think hopefully some of the things I've talked there explains why people might be feeling really anxious, and which are the kinds of people who might be feeling particularly anxious. And that there's a lot of evidence for ACT being very, very helpful for people managing anxiety. And I think, you know, that's really what we're going to be covering as we go later on. We tell you a bit more about the ACT approach. We can explain how that does help people to cope with those feelings. So I hope that's okay, but if we don't cover it, do you know, ask again. Okay, so I think it's over to Beverly now, is it?
Yeah. Well, what we thought would be helpful was to perhaps bring to life a couple of employees who've had the range of COVID symptoms, right from the really severe symptoms right down to nothing and just being furloughed. And then we'll use these sort of cases, if you like, just to explain what the long-term effects might be and how that might impact returning to work actually in the place of work, or if they're still working from home. These are fictional characters, so we're not breaking any confidentiality here. And I'm also just aware as well that we are all susceptible to COVID. We may have had it, we may have been touched by it in ways such that friends or relatives may have been in ICU, or we know employees or whatever who have. So if it's sort of a little trigger warning, but if any of this does activate anything in you, Elizabeth and I are available, and we'll give you our contact details afterwards if you just want to talk something through. So first of all, I'm going to try and move the slide on.
I caught COVID-19 from a work colleague in all likelihood, so my symptoms...
Sorry, my slides suddenly moved on and I don't know why. Oh yeah, so how are different people affected? Well, first of all, we've got Jason. You saw Jason there, and he's had really severe infection, and he was in ICU. So Jason's in his early 50s, he's a senior manager in IT in the financial services industry. And he's just going to tell you his story now.
I caught COVID-19 from a work colleague in all likelihood, so my symptoms showed in the first couple of days after lockdown happened. At first I felt okay, just tired and a bit feverish, and I tried to carry on with my work. My cough began to get worse, and it got to the point where I couldn't finish a Zoom meeting because I was coughing so much and felt really short of breath. That's when I decided to take to my bed and rest up properly. For several days, apparently, I only have vague memories, I drifted in and out of a feverish sleep, and my wife worried about my breathing. I put off calling the doctor because I was convinced that others were worse off. In the end, my wife called 999 because she said I was gasping for breath and she was really worried. The next thing I remember for sure was coming round, obviously in hospital, bright lights everywhere and so much noise. I had a terrible, uncomfortable sensation in my throat, and there was a nurse saying my name and telling me that I was okay. It was terrifying. All the masks and the noise. I was convinced they were trying to hurt me. I was not allowed to see my wife until I left ICU and went to a ward. I've lost so much weight and I'm physically very weak. I'm back home now, but I keep on getting flashbacks to when I was really ill. I think I must be going mad. I feel so different. I've lost a part of my life. I just want to sleep, and when I wake up I want to be the old Jason. I'm going into work, but just going through the motions really. I can't talk to anyone about how I really feel. They just keep telling me how lucky I am and saying stuff like we should all be grateful for the NHS. Sometimes I feel I wish that I hadn't survived. I can't cope with feeling so anxious and depressed all the time. I caught COVID-19 from a work colleague in all likelihood, so my symptoms showed in the first couple of days after lockdown
about this. My
happened.
screen isn't working. Okay, so why does admission to intensive care have such a big impact on recovery? You know, people are treated in intensive care every day for all sorts of things, and not just for COVID. And I think we have the impression that patients in intensive care are unconscious. So we imagine that they're just resting and unaware, but I thought we'd have a think about what really happens. So by definition, only the really sickest people are treated in ICU. And I had to think back to recent experience in ICU and to my time working in ICU. And I thought I'd try and give a list of all the things that actually happen when somebody's in there, just to give you a flavour of it. It's not an exhaustive list. By any stretch of the imagination, but people are sedated. They're in what's called an induced coma some of the time. Sometimes they're a little bit more alert. They have all of their bodily functions taken over for them pretty much. So there'll be a breathing tube in either through the mouth or sometimes the nose, occasionally a tracheostomy. So that's a tube through the neck. They'll have intravenous lines in to measure blood pressure, to measure blood gases. They will have lines in to deliver fluids, to deliver medications. There'll be heart monitors, there'll be oxygen monitors, there'll be urinary catheters, there'll be feeding tubes through the nose or sometimes directly into the gut. People will have one-to-one care for 24 hours a day. Sometimes there'll be more than one person there attending them. There'll be physiotherapists, there'll be nutritionists, there'll be doctors, there'll be x-ray technicians, there'll be physical therapists helping them to move. The list just goes on and on and on. In ICU, the noise levels are incredibly high. It averages around 60 decibels during a day-to-day period. And that's pretty high when you think about a motorbike engine actually revving up. And I just thought I'd give you a taste of that. All that noise, that lack of nighttime, the constant activity is like being in a war zone. And it leads to activation of all of our body's threat and survival systems. It's not a restful place to be. It's not a calm place to be. And our brains are just not capable of distinguishing between being looked after and being under threat. And so what we know happens is that we have really profound psychological and physiological responses to this constant invasion, I guess, of our bodies and of our nervous system. What we know for sure is that something like 60% of people recovering from ICU will develop something called post-intensive care syndrome. It's very similar to PTSD, and PTSD is part of that. It's a huge amount of people who are in ICU. There'll also be really profound physical impairment, and again we know something like 50% of patients develop a new physical impairment following their time in ICU. The first 2 or 3 weeks recovering or coming round, it can often be really scary for people. They develop a state of delirium. They might often feel that they're being persecuted or attacked. They can become very agitated and try and resist the help that's being given to them because they simply can't understand it. And again, this can cause, this is quite traumatizing and can cause effects when people actually do recover. The general rule of thumb for recovery is about a month for every week that you spend on a ventilator or actually in ICU. And I think the longest reported that I could find case of a COVID-19 patient in ICU, and actually in ICU, was 105 days. That equivalates, I think, to about a year of recovery. It's a long time. Okay, Elizabeth, I think this is yours.
Yeah. So the next person we're going to meet is Sula. So I think we've got a recording next.
I don't understand it. I feel like such a fraud. I wasn't that ill with COVID. I got tested because my husband had symptoms. My test was positive, but all I had was a bit of a cough. I did stay in bed for a couple of days, but now, 2 months later, I feel exhausted. I felt tired when I had the cough, but although the coughing stopped, about 3 days after, I was hit by a really extreme fatigue. I don't get it. I've never felt like this. I've always had loads of energy, and it's been a source of pride that I haven't been sick or had a sick day for ages. But wow, am I tired. I try to push myself and some days I get loads done, but then the next day will be wiped out, hardly able to move for several days. Then of course, once I feel better, there's so much to catch up with. I get all caught up with work and the house and then I just feel exhausted again. I don't understand it. I'm only doing what I would normally have done. I worry that something serious is going on, something the doctors don't understand, and I wonder if I'll ever get better.
Okay, so and I just noticed there that before we talk about Sula, that nannies, I can't see with my glasses, saying about having PTSD and feeling in, you know, a negative experience in hospital. And I think, you know, sorry to hear that. And it you know, it is so common and it's so normal, but people do recover from it. And, you know, there is very good evidence that things like ACT can help people overcome it. So, you know, just bear with it. But Sula here, she's obviously experiencing what we might call long COVID now, experiencing this long-term fatigue, because it's really causing difficulty for her in terms of being able to get on with her life. And I think the next slide shows us what typically happens when people develop fatigue. Thanks, Beverly. So I don't know if you've come across this before, but the boom and bust cycle is very typical of what happens to people who get chronic fatigue syndrome. So people start off feeling fatigued because of the virus. They can't do everything they want to do, so they become very frustrated and they start having negative thoughts about themselves. I should be doing something, there's something terribly wrong with me, I don't understand what's going on, a lot of uncertainty, and of course there's no medical explanation that's simple that can be given to somebody. So people have a tendency to blame themselves and become anxious and depressed. All they can do is rest, and then rest does make people feel better. But then what happens, particularly in sort of high achieving people, people who've got responsible jobs and things, they start to overcompensate. So, oh, I let everything slip when I was feeling bad. I've got to get it all done now in case I feel bad again. So they overdo it, get more exhausted, have to rest again, which is the bust part of the cycle, which leads more frustration, increasing fatigue, and then it just gets worse and worse and worse, and this can go on for a long time. But what we do know is if we can intervene early, and ACT is one of the interventions that works for this, then people can get out of that cycle and learn to manage their work and the rest of their life in a way that doesn't lead to this boom and bust, and where they can actually get things done the way they want to. But they often need support because it means changing really the way they think about things and the way they do things. And, you know, that can be challenging for people. Okay. So Beverly and I both work a lot with people who are experiencing chronic fatigue, and I think the thing to think about in the workplace is that we know if you get people early, it doesn't develop into a severe problem as it can do. So having a gradual return to work for people who need it is really important. There's lots of evidence-based techniques that we use. So pacing is the main one, where you get people to use goal setting and action planning, prioritising strategies to get done the important things, but without overdoing it. So planning to do short amounts of activity and then rest, rather than doing as much activity as you possibly can before you get too tired and then need to rest more. and gradually sort of increasing exercise, because the fatigue is very much physically experienced as well as mentally, and people need to gradually increase the amount of work exercise they do in order to be able to get back to their normal levels. And it's very individualized. People respond very differently in different ways, so they have to learn to sort of trust their own bodies and not compare themselves to other people, which can often get in the way. Not to be confused with graded exercise, which is sometimes promoted as a treatment for chronic fatigue. There's some evidence for it, but it's quite contentious, and it's one of those interventions that people in the chronic fatigue syndrome population don't like, because it's sort of, they feel it doesn't really take into account their own individual and personal experiences of fatigue. But just, you know, having scheduled breaks and educating people about sleep hygiene. So what I mean by that is all the sort of things that we know that are evidence-based that affect people's sleep. So, you know, not having caffeinated drinks close to bedtime, not using your screen for an hour before you go to bed, having a quiet, dark environment to sleep in, and then having a sort of schedule where you get up at the same time every day, regardless. That's one of the most effective things you can do. And there are other psychological treatments as well that Beverly and I would be using if we were seeing people in our clinics. Next slide, Beverly. And then in terms of the mental health effects, so we've had a list of symptoms. So how common are they? So there's been a systematic review that's tried to get information from people who've had COVID-19, SARS and MERS, which are all the coronaviruses. So a lot of the data we've got comes from people with severe illness, but they did find that a quarter of the people who'd had this experienced some form of confusion or delirium. Another third of them developed PTSD. And another third had a depression or anxiety, which did improve on its own, but for a small percentage, 15% of those, 1 year following this very severe phase, still had some depression and anxiety. So it's important to remember most people will recover, and it's important to have a sort of hopeful stance on this. Sometimes it takes time, and we're very keen on things happening quickly, aren't we? But actually our bodies don't work like that, and sometimes we have to accept that things take longer than we want. But there will be a proportion of people who will need some sort of mental health support in order to get back to functioning fully. So I think next slide.
I think I'm going to introduce you to Mikey to give you an idea of how different people are affected. And I think Mikey is 23 and he works in accounts at a travel company. And actually he can't see what all the fuss is about.
I got COVID right as we went into lockdown. To be honest, I hardly noticed it. I coughed a lot and that kept me awake on a couple of nights, but I kept on working. I reckon I'm immune now, so all of these restrictions and precautions are annoying. I have to go back to work in the office. People are making such a fuss. They should just get back to work. It's just excuses not to do anything. Now I have to take on the work that they don't do. It's not fair.
Okay, so I think we've all got one of those, or met one of those. And then I wanted to introduce you to Irene as well. She's in her 40s. And works in retail, and actually she's just been furloughed and has not had COVID. So let's hear what she's got to say.
I've just come back to work after 4 months furlough. It's really weird, unsettling really. Lots of my colleagues had to keep working. It makes me feel that my role isn't important. I mean, why me? I work really hard, but suddenly I can be put on leave. How does that work? It makes me feel very insecure. The business is struggling, and now they know they can manage without me. I'm sure I will be the first to go if they make redundancies. Not that they have mentioned the R word, but it's got to be coming surely. I mean, it's all over the news. So many people are losing their jobs. And what happens if I get made redundant? Will I get another job? If I don't, how will we pay our bills? What about Christmas? I'm spending a lot of time looking at job ads, just in case, but not much is coming up, and it makes me so worried. I feel sick and can't sleep. I feel bad using work time for this, but they obviously don't value me. I have to look out for myself.
Okay, so that's Irene there. So really, there are psychological considerations for all staff, whether they've been so seriously ill that they've been in ICU, whether they have long COVID, whether they've just been touched by the disease and not really noticed it, or whether they haven't had it at all. And I think these psychological considerations are really amplified if people are working from home. And that's because working from home is difficult anyway for lots of people. I know we're getting used to it, but it's lonely. People can hide what they're feeling quite easily. They can appear on a Zoom chat or on the telephone and look entirely normal. And yet the rest of the day could have been spent avoiding doing anything, brewing anger and resentment, feeling guilty about the fact that they're still even alive, and just worrying about stuff and being anxious. So I think we have to be especially aware of people who are working from home, because a lot of these things will just be really amplified, and there's nobody really to share it with. I think the fear of contamination is something that's been particularly evident in the work that I've been doing with people, and it's debilitating and it stops people doing things. If you're so worried that you're going to take the virus to somebody else, or somebody's going to bring it to you, you can develop all kinds of behaviours that, with the idea of preventing that happening, but just actually stop you from functioning. You can spend so much time cleaning, so much time in isolation, so much time worrying about what if and how to plan, that actually you just can't get any work done. I've noticed that a lot of people just trying to deal with this anxiety and the uncertainty, and it translates into worrying about their career, because they recognise they're not working properly, they recognise they're not functioning as well as they need to, and they're worried about having to prove that they're good enough to stay in their job, or having to prove that they're better than somebody else, and it can have just huge problems. And I guess the other thing that we need to think about is women, and especially women working from home. But either way, the burden of childcare is falling to women. There's been some research done since March that shows that women are taking on more of the childcare duties, more of the home caring duties, even if both male and female are in the same boat. And I think we have to really consider the burden that they're carrying, especially if their childcare has actually disappeared. So any questions arising from that before we get on to how we might actually begin to work with all of these kinds of employees? No, okay. I'll just leave you a minute just in case there is something coming up. If you wanted to ask a question rather than type it in the chat box, you're very welcome to do that. It might feel easier to do that. No? Okay, well, I'm going to hand over to Elizabeth.
Hello, it's Derek here. Sorry, I've missed bits and pieces because my wonderful internet in my fabulous new office I built isn't good. So one of the things I was looking at is kind of, having worked with the police before around heightened state of alerts and, kind of no turning off and things like that. And I think that's one of the things that's really, compared to many things, this is one of the things that's so kind of pertinent at the moment, is that it is like everybody's on switches constantly there. And, you can't turn off because myself, I've been made redundant, and, I know what that has felt like. So, and I've just been kind of interested in, how we could suggest to people what they can do throughout their day to alleviate that, etc. I'm obviously, I haven't heard what you said about ACT yet, so I'll kind of shut up after that.
Okay, well, we will come on to that. And I work a lot with the police. I have a contract for Hampshire and Sussex and doing their trauma work. And hypervigilance, and the police is trained in, and it's actually how we want them to be. And it's quite interesting sort of watching people in my office. If a siren goes off outside or there's a bang, they're immediately there ready to act, and sometimes have to say, you're off duty now. And it really is that case of of training that skill of hypervigilance away and making it functional for where you are in any particular moment. And we're going to come on to the processes that we develop in people to do that. Because even though things are so different with everybody, what we're working at is a process level, and those psychological processes can be translated into all different areas of your life. So keeping the hypervigilance switched on when you're at work and learning how to switch it off when you're away from that situation.
Yeah, okay. I'll listen out.
Listen out. We'll try and explain. We can't explain it all in 30 minutes, but we'll just try and give you a flavour of the processes that we work with and how we might do that. Do you got anything to add there, Elizabeth?
No, I certainly agree with that, and we do know that definitely how you look at things does have an effect on how you function as well. So that's partly what we're looking at, and so hopefully we'll come on to this in the next section. But obviously, there's lots of time at the end to have questions in more detail once you've sort of had a flavour of what the ACT approach is.
Okay. Right. So over to you again, Elizabeth.
Okay. So the 4 employers we've shown you are quite different to each other. So you might be wondering, what have they got in common and how can one behavioural approach help them all? So this is what we're going to move on to talking about the ACT approach. So I think the next slide is, thanks Beverly. So ACT is acceptance and commitment training, or as Beverly said in the beginning, acceptance and commitment therapy when we do it in a therapeutic concept. And it's always called ACT because it emphasises the sort of active nature. So people are learning skills that they have to apply. It's not just talking about their problems. And there's been a whole hundreds now, if not thousands, of randomised controlled trials to show that acceptance and commitment therapy works very well for helping people to cope with a wide range of health conditions, and also that it works very well in work environments. So it's been used to reduce employee stress, increase motivation, to help people engage with new systems and change at work, which is often challenging for people. And we know that managers who are trained in ACT, who've had ACT training rather, have a measurable impact on their employees' performance. So next slide. So what is it? So, excuse me, it's a behavioural approach, so we'll explain what that means. And the main way, so it's basically around changing people's behaviour, but the way we do this in ACT is by developing this thing called psychological flexibility. So you can see that we'll hopefully elaborate, but the definition's up there. So it's really providing people with an opportunity, and it could be an individual or it can be an organisation, because we can work with strategy or with training days for people. An opportunity in the face of crisis or stress to help them persevere or change their behaviour if they need to, in the service of attaining valued goals and outcomes. So that's what we're focused on next. Thanks, Beverly. So why do we think about behaviour? Well, basically, we don't normally. So most of the time we just act, we just behave in ways we do because it's become habitual or it's automatic. And often the way that we behave is based on the way we're thinking and feeling. And we do that automatically without sort of really trying to understand if that behaviour is the thing that we really want to be doing. And then obviously behaviour has consequences. So it has consequences for us and it has consequences for the people around us and therefore our relationships with them. So, you know, if we are choosing to work all hours, that can have a negative effect on our personal relationships. And then importantly, it's the only thing we can control. So we can't control our thoughts, we can't control our emotions. So if I say to you now, don't think about a polar bear, what's the first thing that pops into your head? You know, now we're all sitting here picturing polar bears, and we might be picturing different polar bears and doing different things in different situations, but we can't get that image out because we can't not think about something. And similarly, we can't control our emotions. So if I said to you, I'm going to wire you up to a lie detector machine and ask you a series of questions, And if you show even the slightest amount of anxiety or get anything wrong, I'm going to give you a very painful shock. Would you be able to not become anxious, not even slightly? It's very unlikely. If I tell you, fall in love with the next person who walks in the room, will that happen? No. So our emotions and our thoughts just happen, but if we're aware of them, then we can choose how we behave in response to them. And that's the sort of skills we're teaching in ACT. So next slide, Beverly. And then finally, behaviour is important because as, you know, organisations, we really want every employee to have the chance to sort of show up more frequently as the person they choose to be. So we know that if people's values are aligned with their organisation's values and they feel valued and they feel that they're being true to themselves, then they perform better, there's more job satisfaction, and we have less staff turnover as well. So lots of good reasons on a personal and organisational level to want to think about this. So how do we do this? So that's the next slide. So thank you. So what we do in ACT is help individuals, or again organisations, to identify what's important to them, so what their values are. And we often talk about this in terms of a compass bearing. So I know at work we talk a lot about goals often and the things we want to achieve, but our compass bearing, or our values, are really what our goals and achievements are leading us towards. So it's a bit like if we said we're travelling west, you're never going to arrive at west, but that's just a direction you can go in. So that's what your values are. You're never going to achieve a value, but if you're very clear what they are, and often people find it very difficult to know what they care about because we have so many people telling us what we should care about, you know, our employers, society, the media, that it's very easy to get lost. So in ACT, we do a lot of work with people, getting them to understand what makes you you, what do you care most about, and then helping them to align their goals and behaviours with those values. So next slide, I think. So how do we actually do that? So I guess we need to think about, if we had an example, say, of well-being being a value, or wanting to be a good provider as being a good value, what sort of things could you do in the workplace to help you move towards that value? I don't know if anyone's got any thoughts on that. So, you know, we know to have a good work-life balance, to achieve well in our jobs, you know, just turning up every day is important. Maybe having regular breaks for our well-being, having good relationships with colleagues, taking our annual leave, pacing ourselves. Those are all kind of things that we can do to help us move towards our values of having good well-being and achievement in our jobs. So we kind of know what we're supposed to do, but often that doesn't happen. And there's lots of reasons for that. And those are the kind of things that ACT can address. And I think Beverly's going to talk about next. Oh, I see Derek's put one in there. Yes, encourage openness. So did you want to say a bit more about that, Derek, what you meant by that? I think, oh, you're on mute, sorry.
Well, I suppose that comes down to, I mean, you're saying it depends on, is it as what the individual wants to do, but individuals contribute towards the culture. So in a kind of in the spirit of, like, if somebody, you know, we all know there's mental health, we've all got mental health, etc. We know this, but if we encourage openness, where people go, well, do you know what, I'm having a shite day today, or I'm having a bad day. Actually, you know, by doing stuff like that, it makes it easier for people just to be at them, you know, to be okay about themselves, and just yeah, and not too over, you know, like, if you're equating, you know, I'm having a sprained ankle day in my head today, rather than thinking my leg is broken.
Yeah, yeah. So yeah, important. And I suppose it comes down to organisational culture, isn't it? And about organisations being clear about what their values are and why, and in order for people to feel able to do that. Yeah.
Okay. So my experience of working with individuals and groups and probably Elizabeth's as well, is that 99% of the people know what it is they need to do. People just know what they need to do, but somehow something gets in the way of them doing the stuff that they need to do. So it gets in the way of them taking regular breaks, or it gets in the way of them switching their computer off at 6 o'clock at night, or it gets in the way of them telling their boss they're unhappy, or that they're not working, feeling very good. And it's curious, isn't it, that this stuff all comes down to 3 or 4 basic things. It's our thoughts, it's our feelings, and it's our body sensations. And by that I mean the stuff we feel inside our body that actually gets in the way of us doing what we would really like to do. So I thought I'd show you how the 4 characters that we've already looked at, and sort of pick out the stuff that might get in the way of their recovery or of them working well. And we actually get people to identify their stuff, and we call it not wants. It's the stuff that they don't want to have, because unless you name it and identify it, it's actually very difficult to then work with it. So let's have a think about Jason. He came up with thoughts that I think I must be going mad. I feel so different. I've lost part of my life. I can't talk to anybody about how I feel. I wish I hadn't survived. I can't cope. I'm having flashbacks. I'm anxious. I'm depressed. I feel weak and I feel tired. That's an awful lot of not wants. That's an awful lot of stuff that somehow he's got to overcome in order to do the stuff that's important to him, to start living his life fully and working really productively again. And that can be a real challenge. So for Sula, again, she's tired and exhausted. She thinks something's really wrong with me. She's worried something serious is going on. She's anxious again, and she's wondering, will I ever get better? And if you're having those kind of thoughts and feeling those kind of feelings, it's bound to direct your behaviour in a certain way. Mikey, he thinks he's immune. That's going to direct his behaviour in a certain way. It could be really frightening for other members of staff if he's wandering around not taking notice of COVID precautions because he's thinking, I'm immune. He's getting really irritated. He's thinking people are making such a fuss and it's not fair. That's going to direct how he feels about things and how he actually conducts his behaviour in the workplace if he's not aware that he's doing it. And finally, we've got Irene, who thinks my role isn't important and actually I don't think I'm really valued here. And I'm so worried that I'm going to lose my job. I'm going to have to start looking for jobs at work. So a lot of her energies at work are actually being diverted away from work in trying to protect herself in case something happens, because she's got a strong belief that people don't value her. And again, that's directing her behaviour in a way that's not really productive for work. So the most common thing for anybody, whether you're a human being or whether you're any organism really, is that we try and fix it if something happens that we don't want. So when we have thoughts and feelings and body sensations that are uncomfortable or painful or just downright unpleasant, we try and fix it. And our culture encourages us to fix it. And those fix-its come in the form of distractions. So, and I don't know anybody who doesn't do a distraction. I know mine is spider solitaire if things get a little bit too much, and people do all sorts of other distractions. It might be social media, it might be binge watching Netflix, it might be going for a run, it could be all sorts of things. Then we tend to opt out of stuff. We avoid things. So in the work context, it might be avoiding a difficult conversation because we're frightened of what somebody might think of us. We might avoid even going to work because we're thinking, I can't do this, there's something wrong with me. We might avoid deadlines. We might avoid sending emails or making telephone calls. There's all sorts of opting out. We try and think our way out of it because we're thinking creatures, and this is something that separates us from other animals, but we try and think our way out of it. Sometimes, and I've seen it quite a lot in the COVID pandemic, people blame other people for it or blame something else for it. And it's very convenient because if it's somebody else's fault, then you don't have to do something about it and you don't have to take responsibility. And this manifests itself a lot in the work environment. Sometimes we do lots of overthinking. We set about worrying things that we can't do anything about. Our minds are in the future. What if, what if, what if? Or they're in the past, if only that hadn't happened, if only that hadn't been the case. And we try and think our way out of this. We try and use our problem solving to think our way out of our own personal problems. And then we turn to substances or other things. Substances could be food, some of us comfort eat, some of us withdraw from food altogether. We might take to an extra glass of wine in the evening or an extra bottle in the evening. We might smoke weed, we might use prescription medications. We might do things like seeking help or reading self-help books or seeking counselling or just seeking reassurance from other people. There's all sorts of things we do to fix those horrible feelings and thoughts that we're having. And what seems to happen is that we get stuck in a cycle of fixing it and then it coming back, fixing it and then it coming back. And we never seem to move forwards. We never seem to move towards what really matters to us. We just end up moving away from that. So how do we address this? Well, the psychological skills training we've been talking about in order to overcome the fix-its can be, I guess, grouped into three different categories. The first is actually being present. It's developing skills for present moment awareness. The second one is being open. And what we mean by that is being curious and being not being held tightly by thoughts and judgments and evaluations that we might have about how we're feeling and how we're thinking. And then the final thing is developing the skill to become engaged in what really matters to us, even though we're having horrible stuff going on. Not trying to get rid of it, but taking it with us, if you like. So an example of that might be that you're too frightened to ask for flexible working because you're worried about losing the job. But the costs of not asking are that you're going to be overworked and that your home life is going to suffer, the children might suffer. And so you have to take that thought and that feeling of anxiety and that feeling of dread with you to ask for something that really matters to you. And this happens day by day by day, moment by moment to all of us. And these skills can be translated into all aspects, so whether it's work life or whether it's home life. So how do we do it? How do we get present? Has anybody got any ideas how you get present? What that actually means? One of the things that comes up a lot at the moment and is a bit of a buzzword is mindfulness. And what we're talking about is being mindful. But in the ACT sense, it's not quite so much being mindful in the sense that you take 20 minutes a day to sit and meditate, or 40 minutes or however long it takes. What we're talking about is moment by moment noticing of what's going on inside your body and what's going on around you, so that you can press a pause button and respond in a way that serves you best rather than react in a way that really doesn't serve you particularly well. So I'm just noticing a couple of comments coming up, so I'll just check and see what they are at the moment. Yes, Nani put meditation, and Sophie, yeah, being aware of the world around you, absolutely. And Nani saying meditation helps to develop a mindful skill. Absolutely, that's what happens. And what we're doing is trying to take people from being mindless into being mindful. And we're not suggesting that needs to happen all the time, but we're just suggesting that you might need to notice what you're reacting to in your body, so that you can act in a way that best suits you. So what I'm just going to do at the moment is I'm just going to put on my screen, but you won't see that. I'm going to put all your faces up so that I can have a look. And I'm just going to do a mindful noticing exercise with you, if you're willing. Okay. So just in the next couple of minutes, what I'm going to ask you all to do is to think about your favourite Christmas carol, and then in turn, I'm going to unmute you and I'm going to ask you to sing the first verse and chorus of your favourite Christmas carol, okay? So just take a minute to have a think what your carol is. And if one of you wants to start, is willing to start, you can perhaps unmute yourself, and we'll go around in turn and we'll sing that first verse. Okay. Okay. All right. And I'm seeing all your faces here, and I'm just going to stop you for a moment. I'm just kidding. I'm not going to ask you to do that, but because I would hate to do that. But what I want you to do is just notice what showed up for you when I suggested that that's what we might do. What was your body telling you? Did you notice your heart rate suddenly go up? Did your cheeks suddenly flush? Did you start shaking? Your body will have told you something in those moments. What was the first thought? Was it, yay, I've got a chance to shine now, my big moment? Or was it not likely? What is she on? I'm not doing that, no way. And what were the feelings that were generated? Is there a bit of anxiety going on there? Is there a bit of fear, a bit of pre-embarrassment? There's a few chats things come up, so I'll just have a look and see what people came up with. Derek found it amusing. And Sophie, oh no, what can I sing without sounding foolish? Okay, so people began to notice stuff, and Claire thought, how lovely, it can reconnect with happy memories. That's beautiful. We will all have different responses. I'm not suggesting that everybody's responses are going to be the same, but what I'm suggesting is that in those moments, if you can notice what you're reacting to, you can press the pause button and decide what you want to do. If your life depended on that, would you be able to still yourself and go ahead and do it? Or would you just switch the video off and check out of the meeting? So what we're doing is learning to contact the richness of the present moment, in the full knowledge that that might be awful as well as pleasant. Just being mindful doesn't mean that life's going to be suddenly great. Okay, the open skill. What we think about for being open is practicing curiosity, practicing the skill of having an open heart and approaching what happens to us with a sense of willingness and just curiosity. And that means holding lightly stories of your own limitations, of your own judgments and evaluations. And it's a skill that we really need to begin to develop. For example, we talk a lot about anxiety, and several people have already mentioned anxiety. But what if we were open and curious about that anxiety? What if we approached those sensations that our brain interprets as being anxious in a completely different way? So what if we stopped calling it anxiety? What if we noticed in our body that your heart was just beating a little bit faster, that there was a sensation in your tummy? What if you were just able to move your body a little bit, just to soften up, just to open up and just say, okay, that's already here. My brain's telling me that I'm in danger, but actually I'm just in the office and I'm just about to speak to my boss. Or if we could just hold that in a different way. What if we could notice the thoughts, I'm going to sound stupid, and just get some distance from that thought? Not try and change it, but just decide whether it works for us or whether it doesn't, and just hold it in a different way. And we're all able to do that to some extent in some situations, but what we do is develop that skill so that you can become aware of it, of how you're limiting yourself and how you're moving away from what matters to you. And it might sound difficult at the moment, but actually it is really possible to do that. And then what we do is encourage people to become really engaged with what's important to them. And Elizabeth's already spoken a little bit about this, but helping people to work out what they want to stand for, how they choose to show up as a person. Do they want to choose to show up as a person who's committed to working, as being part of the team? Because what we find is that when people don't know what they're working towards, that it's very easy to behave in a different way. And what we try to do is encourage people to establish shared values within their teams, within their organisation, and that fit with how they think about themselves. So we'll move on now, and Elizabeth's going to talk to you about the next little bit.
Beverly, before we move on, there was a couple of comments in the chat.
Oh yeah, okay. So having a look. Okay. Nani's saying that our body sensations give us helpful information, and that's absolutely right. It gives us data that we can work with, and what we need to discriminate is the data that we've learned to associate with those sensations and relate it to the current context, to the current environment. Because remember when I talked about Jason in ICU and his brain being unable to distinguish between all of the people, everything that was happening to him to save him, it was unable to distinguish between that and being in a war zone and being under attack. And that's very much the same with our sensations in our bodies. You know, our brains can't discriminate. We've still got the same software in our brains that was around when we were in living in caves, and it's not updated. So we have to be able to check in with ourselves and recognize that this signal that we're interpreting as life or death actually isn't life or death. It's actually just sitting in the office or about to make a phone call. And I think that's absolutely right. We've got to learn to discriminate that data. And Claire's saying, trying to notice the physiology and seeking the opportunity of what that can offer. I think that's a really lovely way of putting it, because so often I think people say, oh, I just wish I had more confidence, or I just wish that I was braver, or I just wish I had more patience. And actually, every time it's an opportunity to develop that patience or to develop that confidence, and waiting for our physiology to disappear, or for our thoughts or feelings to disappear before you start doing something, isn't actually going to get you very far, really. It just keeps you quite stuck. Okay, over to you, Elizabeth.
Thanks. Yeah, and you know, I would just add to that you know, no thought or emotion or even a fix-it that we do is wrong in itself. Things become problematic if we're not aware of them and they're pushing us in a direction, so we're being reactive rather than proactive. So, and that's why the values thing is so important, and the being aware is so important. So we can only really choose to do what we want to do if we know what our direction is. So if we're very clear about our values, and if we can really be aware and listen to what's going on in our heads and in our bodies, so that we've got that space to make the choice of where we want to behave, rather than reacting to those things to make them go away, as Beverly was talking about. Yes. And you know, we've talked a lot about individuals and values and what you want to do, but obviously in a work situation we want our employees to have shared values with us. So these were just some of the questions that we thought are worth, you know, really considering in the context of people returning to work, you know, recovering from COVID. You know, so what are your organisation's values, you know, and how do they fit with people's return to work from COVID? You know, what does your organisation most want to stand for in this pandemic? You know, what's most beneficial for you and your employees? And what are the kinds of things that your organisation could do more of going in the value direction? So I don't know if you've got any thoughts of those. I think on the next slide we've got some ideas, but yeah, so some of the things you might want to think about in terms of, you know, your value directions are, you know, the content of your return to work interviews. giving people flexible working opportunities to take into account the difficulties they might be experiencing from COVID-19. You know, listening to people. So we've talked a lot about, you know, there isn't a sort of clear explanation why some people feel fatigued and some people have high anxiety or anything, although we understand it a bit. The most important thing is to listen to people and believe them, trust them, and have an individualised approach. And, you know, just allowing time for people to go to their medical appointments if they need them. And then, you know, we've got resilience training, but I'd like to use that term carefully, because I think sometimes people are a bit suspicious of that term, because it sometimes feels like it's an excuse for a company to sort of throw anything at people and then say it's up to you to be resilient. So again, just having ACT-informed resilience training, which is very much around values and how you develop strong psychological skills to take you down that valued path. So.
Yeah. Can I just come in there, Elizabeth, and just say I think that it's really important, and quite a lot of the feedback that I've had is where companies have tried to be proactive, and they've started a mindfulness course or a yoga course, or somebody had a massage chair in that they could have 15 minutes on a massage chair in the reception or something like that. And quite often a lot of these things are given to the employees, and they feel it's just one more thing that they've got to do, one more thing that they've got to fit into an already busy schedule. And so the onus has become on them to do that. And so then they fail at that because they simply don't have time to do yoga at lunchtime or to do their mindfulness practice or whatever. So I think that's a really important point about using the training on resilience wisely and carefully. Yeah. Okay.
This is a sort of list of fix-its, but you might have others that you think of. So the typical things, you know, as Beverly was talking about, fix-its are where we sort of don't want to face up to difficult things. So we do things to try and fix those difficult thoughts and feelings and the difficult challenges we have at work. And sometimes those are the sort of knee-jerk things that seem very obvious, but actually can have long-term problems. So, you know, bringing people back too soon when they haven't had a chance to recover physically and mentally can cause longer problems. You know, revising policy on the hoof in a sort of reactive way can make people feel that their companies aren't sort of fully in control or fully listening to them. And the same with authoritarian management styles and increased monitoring. All these things sort of create that sense of distrust with people who, you know, already are feeling a bit uncertain, not understanding themselves why they might be feeling bad, you know, in the case of people with long COVID. And then if they've got people at work telling them they should be doing more, watching them more, it's only going to increase their stress and anxiety, which is going to lead to more time off and less engagement with work. And then also, you know, just not doing anything about it. You know, we've come across lots of companies who are just sort of, well, let everyone do their own thing and not really coming up with anything to help address it. So I can see Steve's got a comment. Let me just put that up. The fine line between supporting staff and monitoring. Yeah, I think that's really true, isn't it? And I don't know if you want to say more about that, Steve, or call on you. We're a small group here, friendly group.
Morning. Can you all hear me?
Yes.
Yes. Yeah. Sorry. With me being on the front line and coming across COVID every day and doing return to works for staff, we do support them, like, and give them as much encouragement as possible at given time. But there comes a time, like, you know, where we've got to say, you know, we need our staff, and sometimes, like, you know, we could be monitoring too much, and it frightens people into thinking they're going to be going down the disciplinary route for absences. So it is a work in progress, like, and we are doing this just like COVID. We are learning every day as we go along. Yeah,
I think that's very true, and I think, you know, that brings us nicely onto the sort of next slide, really, which is why the ACT approach is sort of different, because it's not just, so you might have come across sort of support through your EAP schemes if you have those at work, and that just often includes, you know, just listening to people and signposting people to other services, which is important. But with ACT, we're really working together with people to help them see, you know, where do they want to be, where does the company want them to be, how can we sort of help people to move in that sort of shared direction. So very much focusing on, you know, how we can support people but help them to change their behaviours in ways that are beneficial to them, which will also be beneficial to the company as well. And, you know, it's really a training, it's a process-based training. So the skills you use at work through ACT are also applicable to outside life, because really work and life aren't as separate as we sometimes like to think. And also it's very much individualised. You know, we don't talk about diagnoses and we don't medicalise things. It's very much focusing on the individual, what their own thoughts and emotions and behaviours are as well. So we can move on to the next slide unless anyone's got any questions about what ACT is, because I'm just really going to summarise what we've said next. But we can have some questions right at the end if people prefer that. Thanks. So yeah, so we're sort of coming towards the end here, and so I think hopefully the workshop's covered the sort of multiple physical and psychological effects that happen in recovery from COVID-19, but also highlighted who might be at risk. But you know, the main message is it's very difficult to predict, that individuals are very different, and really we just have to listen to what that person is saying to us. And that ACT can help because it is an evidence-based intervention that helps people clarify their values. So that gives them sort of a direction to move in, and teaches psychological skills which will help them change their behaviour, which will benefit both them and the organisation. And so that by being sort of ACT informed, organisations can intervene to sort of help adjustment in their employees to COVID-19, to be adaptive so that people can be just as productive and show up in the way they really want to be at work. So yeah, so I think that's all we really mostly wanted to say. We could maybe put up our contact details on the next slide, and if anybody's got anything they'd like to comment on, I think we've got a few moments left that we could address any particular questions.
I might just stop the sharing because we can pass those data details on, and the next slide actually is a list of links that you can go to, which is for evidence bases of evidence-based sources of support, because there's a lot around, but it's not all evidence-based. Okay, I'll just stop that share now. Okay, so there's a thank you, Derek. Obviously having connection problems there, yeah.
Yes, and I think, you know, that's something that we can use ACT for, isn't it? That we all are experiencing a lot of frustration at work. And I know I've just moved house and I've recently discovered anytime the wind blows hard, my internet just crashes, which I think is something to do with the telephone line. So, you know, I can either get frustrated and go, this is impossible, I'm not going to do this, or I have to learn to think, this is the way things are. You know, I do feel frustrated. Nevertheless, I'm going to develop some skills to be a bit more patient, which is not my normal nature, but to be able to do that in order to get the job done in the way I want it done.
Absolutely.
I'm beginning to say, well, a lot in my life.
Yes, definitely.
Thank you very so much, Beverly and Elizabeth. That was very, very interesting, actually, and enlightening. And if there was ever a time where there's a need to manage people on an individual basis, it's clearly people returning to work. It's going to be so, so important to listen to them and you know, treat them individually and listen without judgment, etc. And give them as much support as possible. So that's coming across very clearly. And hopefully the line managers and team leaders will get lots of support from their organisations as well on how to enable that to happen. So it's really useful. Thank you.
Yeah, good. And I think, you know, we're all in that position. It's not just our employees that we're supporting. We're all like that. We're all feeling very, very uncertain. But, you know, as I said to somebody the other day, you know, look back over your life. Could you have predicted everything that's happened to you? You probably haven't. You know, we set off on a journey, don't we? And we have our bags packed with our tools and we have our plans. But actually, we're looking down a road and what we see there is actually often an illusion anyway. So just learning to kind of sit with that uncertainty. Hopefully, we can all benefit with that going forwards. And, you know, maybe that's an opportunity COVID-19's giving us.
Yeah, absolutely.
Yeah.